Coronavirus cases are skyrocketing across the country. At last count, more than 11 million Americans have contracted the virus. At least 247,000 people have died. More than 70,000 Americans are hospitalized. Here's a look at states that currently have a mask mandate. As you can see, there are still a handful where masks are not required. Scientists and medical experts overwhelmingly say wearing masks saves lives. Cases at nursing homes are also spiking again. In the first week of November, new cases tied to nursing homes surpassed 24,000, according to the COVID tracking project. That is the worst it's been since early August. CBS News correspondent Carter Evans is in Salt Lake City with more.
Craig Watson visited his mother Ray at the Avalon Valley Rehabilitation Center in Salt Lake City every Sunday until early March, when the facility closed to visitors.
I had no idea I would never see her again.
Almost 5 months later, Ray tested positive for coronavirus. Watson could only say goodbye over FaceTime the night before she passed away.
What's your favorite memory of your mom?
She was a character. I mean, my favorite memory of her was her personality. She was always good and up for anything, and she was just a lot of fun, and I miss that.
While most facilities have banned outside visitors, residents are still at risk of being exposed to the virus through unknowing caretakers.
Frustrated for us because we couldn't see her, but there's people from the outside that are probably more likely exposed than we are going in there every day.
We cannot create a bubble around the elderly folks living in nursing homes.
Rebecca Gerges studies public health policy at the University of Chicago. In a newly published paper, she looked at 6 states currently experiencing surges, including Utah. As cases in the community rose, she found weekly cases among nursing home staff more than tripled, and resident cases more than quadrupled from June to October.
We find that community spread is the largest predictor of which nursing homes experience cases, and then which nursing home experience a severe outbreak with lots of deaths.
Part of the solution includes rapid testing of staff on site. 87% of nursing homes now have access to rapid testing machines, but a Kaiser Health News study says concerns about accuracy and a shortage of testing supplies have prompted many facilities to continue to send samples to laboratories. Experts believe eliminating test delays and reducing community spread are critical to reducing nursing home infections.
I just think it's common sense to do everything we can, whether you believe it's political or not political. It just seems common sense to protect the most vulnerable among us.
The Avalon Rehabilitation Center says it can't comment on individual patients, but it does use outside contractors like therapy staff. It also says it meets all federal screening protocols, and it's thankful for some of these new testing methods, including the rapid test machine. Carter Evans, CBS News, Salt Lake City.
For more on how local communities are handling the coronavirus, I want to bring in Laura Curran. She's a Democrat serving as county executive of Nassau County, New York. Laura, welcome. Thanks so much for being with us. You wrote a powerful story in The New Yorker about the struggles your Long Island County faced as the pandemic began. Can you share some of your experience and what your county did to overcome those dark early days?
Yes, absolutely. First of all, thank you so much for having me on. You know, the county level of government is the level that's really on the front lines and on the ground fighting the virus. We're the ones with the health department, with the ambulances, with the medics. We're the ones with the morgue, medical examiner's office, and all of the outreach offices, social services, setting up the testing, setting up food distributions, whatever it may be. So I felt, you know, as a former reporter, it was good to have that perspective, letting people know what it is that county government actually does. And, you know, I wanted to share that. You know, I think there's a lot of static and a lot of politics that gets into this. Wear a mask, don't wear a mask, what all of this means. But at the end of the day, it's us at the county that have to actually make all this work and keep our residents safe.
Yeah, it's so interesting how county government really, you know, the buck stops there. The streets have to get plowed, the playgrounds have to be kept clean, you know, it all happens on that local level. So, you know, Nassau has long been a purple county in New York, and you wrote about how, as a Democrat, you've worked with the Republican county legislature to get people what they needed. But you also discuss experiences you faced with so-called anti-maskers and people who demand to open the county. What do you think local officials can do to not further politicize the virus? And how do you protect all citizens in the county knowing there's such sharp opposition to some basic public health measures out there?
You know, one thing I've learned is if you boss people around and preach to them and proselytize, a lot of people are going to tune out. I think we had a lot of success in bringing our numbers down because the tone that we always took was, here are the facts, here are the numbers that you need to know, here's how you can protect yourself. And I think people in Nassau County, our businesses, our schools, our residents really used common sense. And that's something that I would just reinforce. And I thank people for using common sense. You know, now we're seeing the numbers start to go up a little bit. And it's really not happening in the businesses. It's not happening at the restaurants. It's not happening at the gyms, at the bowling alleys. It's really these other social gatherings. And so the last thing I would like to see is our businesses have further restrictions when they're playing by the rules and they're doing the right thing and they've sacrificed so much and invested so much, whether it's in the plexiglass or the social distancing or sanitation or whatever it may be. Same with movie theaters. We're not seeing outbreaks now that they've reopened in those kinds of places. So again, I just ask everyone to continue using the common sense so our kids can continue going to school, where frankly they need to be. As a parent myself, I can say that. And that our businesses can continue to be open and to make money and to employ people. I mean, we really are in this together, and it's so important that our businesses can be strong and can function.
And Laura, you know, Nassau County faces quite a large deficit, a $750 million deficit, I believe, over the next 2 years. And you say you are lobbying Washington for help, but lawmakers don't seem any closer to a deal. Senate Republicans have particularly made state and local aid a sticking point. So what help does Nassau County and many like it need from state and federal government to help families and businesses rebound economically?
You know, I am hopeful that there is aid for local governments because we are on the front lines, but I think Washington has proven that we can't rely on it. If we rely on it, we'll be waiting a long time. So we were able to put together a budget that closes the gap. We have a $3.3 billion deficit, closes the gap without raising taxes or cutting services by using all the tools that we have available, by refinancing our debt at very good interest rates. And also, you know, making sure that we can continue to provide these services, these life-saving services that people rely on while being fiscally disciplined. That's something that, you know, it's my end of my third year in office. Fiscal discipline has left us with a bit of a surplus. That cushion helps as well, but being efficient with how we use our money.
Absolutely. And Laura, the latest data, as you mentioned, is showing that Nassau County is ticking up in terms of its positivity rate, as so many other, you know, counties around New York are. I believe it's above a 3% positivity rating as of last week. So going forward, what do you think that Nassau County has to do to make sure that curve stays flattened, especially going into the holidays?
We have to make sure that we're getting testing where it needs to go. When we see these microclusters, these spikelets starting to pop up, we've got to get the testing into those communities, working with the civic leaders, working with faith leaders, working with elected officials to get testing. And that's something that we've done down in the 5 towns, up in Great Neck. And also appealing to people. And I understand that people have COVID fatigue and they want to have the wedding, they want to have the birthday party, the Sweet 16. But to just ask them to continue to use common sense. And again, if you're not worried about yourself, if you're not worried about your family, think about the businesses that have spent thousands of dollars and been shut down for months and are now starting to find their feet again. Do it for them.
So many sacrifices that so many have made, and we're almost there. It's just like that final push to get over the finish line. Nassau County Executive Laura Curran, thank you so much for joining us.
Thank you, Tanya.